SuperTalk.fm. We're also streaming from that SuperTalk Mississippi app and your local SuperTalk Mississippi radio station. But don't forget to watch us. We are also on your computer, your mobile device. Just head on over to SuperTalk TV. And if you're thinking about this year's back-to-school checklist, then make sure you include a visit to the eye doctor, because the American Association, I won't get it. Optometric Association, Dr. Reed, I'm glad you're laughing. I just felt right into it. They want you to make sure that your kids can succeed in the classroom. Dr. Stephen Reed, he is the president of the American, so you say it for me.
Optometric,
I'm going to get it right, Optometric Association. And you are from McGee, Mississippi. So welcome, Dr. Reed.
Hey, thank you. It's a pleasure to be here. And by the way, you are not the first person by far who misses that word. So no
I
worries.
thought I was going in for like optometry, and then it threw me. You would think that I would have read it completely through. I was like, oh, American Optometry. And I was like, oh, no, optometric. So anywho, now folks will remember it, get a good laugh, and it will be something they won't forget this afternoon, which is a good thing. So let's talk about vision problems in terms of children's issues in school. Is this a bigger problem than some parents realize?
Yeah, I think it really is. You mentioned about how the back-to-school eye examination should be on the checklist, but I really believe it should not only be on the checklist, but be circled twice and highlighted, because it's vitally important. And it's really important for a couple of reasons. If you even step back before school starts, from a developmental point of view, when a child is born, most people are surprised to know that that child does not see 20/20, and that's totally normal. But just like the rest of their body, as their body develops, their visual system develops. And then at some point, yes, they do, if everything goes well and it goes according to plan, they have that 20/20 vision. If something happens, though, during that developmental process, say there's some type of vision disorder, some type of eye disease, that can impact that developmental process. And if it's not caught, and then that continues to the point to where that elasticity or that developmental process starts to solidify, then that problem can be locked in. So it's super important that we check children even before schools get started. And then, of course, on the second aspect of that, from a learning perspective, you can imagine trying to go to work every day and not be able to see. And imagine that in a classroom. The child is in the classroom, they're trying to learn. And you would think logically, okay, well, the child's going to let us know that they can't see well and we can get them to the eye doctor. But many children don't know what they're supposed to see, and they don't know to complain. They just think that the way they're seeing is the way that everyone does. And so it's really, really important that we check, that we do a comprehensive examination and ensure that children start out right and then continue that way during school.
Dr. Reed, if you are following with your well baby visits, I know you would go ever so often, and obviously they get further and further apart, and now my kids are down to just once a year for their wellness visits now that they're older and in school. Is that something your pediatrician is looking at, or is this a completely different eye exam or eye check that parents or caregivers should be thinking about for those school-age children, or I guess younger?
Yeah, this is completely different. What the pediatrician does, and say what school nurses and programs do, the vision test, that is only about 5% of what is done in a comprehensive examination. So we are talking about something totally different. And so it's important because a lot of these vision screenings miss problems. And that creates a false sense of security, say, for the parent, because they go in, they get checked, they get a note at the house that says, hey, your child, they passed that screening, they're good to go. And they don't think, well, I still need to have a comprehensive eye examination. And so that child who then has a problem that was missed, it doesn't get addressed, and it just continues. So it is a problem. We do advocate for, all the way from the beginning, a visit with your doctor of optometry for a comprehensive eye examination, because it is so much more than just a screening.
So is it one of those things, Dr. Reed, where you would go maybe, right before kindergarten and just have a baseline and then follow up as needed? I know as you move in greater in age, as now at 40, I see one once a year. That kind of just came, sort of with age, to stay on top of some eye things. Is that kind of like a good rule of practice for parents, just to go ahead, at least go once, get that full exam, and then create that relationship, and then I guess build follow-ups as needed?
Yeah, it may surprise you, but we actually recommend that a child have their first comprehensive exam at 6 months to 1 year old
I failed.
at the optometry office. Yes. And you may think, well, how in the world do you check a child that age? And, we're really not dependent on what the child has to say because they're not saying anything, but we use objective testing, and we can do a very accurate job. So let's just say we check them into 6 months to a year and everything's looking good and on track. Then we recommend that the second visit be between that 3 and 5 year range, say in that preschool range. Obviously, unless the parent sees a problem, then bring them in sooner. And if that looks good, then starting in grade school, we recommend checking on a yearly basis.
Okay. Well, I failed on the 6-month thing, but I might can do better with the one that hadn't made it into kindergarten yet. And then obviously, with the one that's a little bit older, probably failed there too, Dr. Reed. But I think the important part here is the fact that I was the one that fell. I'm the parent who, thought that just the screenings from your pediatrician or, all of that was kind of catching it all. But you're saying that there could be things that are undiagnosed. And especially if you have kids who are struggling with reading or seeing the board or, now on devices, this just could be another route for you to get some peace of mind.
Oh, absolutely, right. And I'll tell you something real quick on that, the problems, say, with children and the ones that have focusing issues, and I'm talking about mainly up close, they'll fool you because they look great on the playground. They're interacting with the kids. They can see far off, and you think, well, they're doing fine. But yet, when they go to read, they find it either difficult because they can't see well or it's uncomfortable. And this can really create a bigger issue in their life because sometimes this aversion to learning can create a scenario where they are labeled as slow learners when, in fact, they're not. Or maybe they choose to act up in the classroom because they don't want to learn, and they're labeled as having some kind of behavioral disorder. And so these things can go well beyond their childhood years into their adult years.
Good stuff to know, maybe giving some families some hope or just another route to go and think about as we sort of move back into this school year. I want to ask about screen time and impacting eye health. I mean, screen time's a big thing for parents. We are all trying to navigate that for ourselves as also for the littles. But from an eye health standpoint, what should we be thinking about that?
Yeah, well, certainly limiting screen time, and that's easy to say and hard to do because it is, all around us every day. With kids, what can happen, and we're seeing this more and more, is that a child who continually looks at up close devices, the focus and system in the eye, the closer you look at something, the more the internal muscles have to tighten up in order to see. So it's kind of like focusing a camera in a way. And if the child is continually focused up close and that muscle stays tight, then eventually it can kind of become more locked in or like a spasm, so to speak. And your brain says, well, if all we're going to do is look up close, then let's just make these eyes nearsighted so they can see great up close. And that helps up close, but now the child is blurry, far off, and so they have to have glasses or contacts for distance all the time. And so as a result of this, what we have seen is the incidence in nearsightedness or myopia has increased twofold in this decade versus the previous decade. So it's definitely impacting children as well as adults. Now, I'll tell you just a real useful tip, and we call this the 20-20-20 rule. And what we recommend for both children and adults, and that's even if you have glasses, contacts, or your vision's totally normal, is that about every 20 minutes, stop and look up at something that's at least 20 feet away. Because 20 feet and further away, your eye muscles don't have to focus. They can totally relax. And do this for 20 seconds or more. And by taking those frequent breaks, you keep those muscles more flexible, and certainly we can help to mitigate some of the issues with increased screen time by doing just something as simple as that.
Good deal. 20-20-20. You can remember that because you want 20/20 vision. If you don't, you want to keep the vision that you got. And so you should get it checked. So, Dr. Reed, do you need referrals for your optometrist or your eye doctor? Or is that something parents and caregivers can just look up what's in their local town and call and make an appointment?
Yeah, they can just call and make an appointment. And if you don't know or don't have a relationship with a current doctor of optometry, you can go to the American Optometric Association's website, which is AOA.org. And there's a doctor locator, and you can type in your zip code anywhere in Mississippi, and it will give you a list of doctors that are close to you that can take care of you and your family vision.
All righty. Well, you've given us a lot to think about. Thank you, Dr. Reed, American Optometric Association president right here in Mississippi. I got it right finally, Dr. Reed.
You did. Good job.
Learned a new word today. I appreciate your time.
Okay. Thank you so much. Enjoyed it.
All righty. Optometric. Who knew? Yes, Jeff and Pontotoc. Words are very hard for me some days, but you guys stick with us. We got more for you coming up next.